Welcome back. A Utah doctor has seen a disturbing trend of people who have recovered from COVID-19, yet they're still not feeling 100% with symptoms that have lingered well beyond the patient's so-called recovery. ABC4's medical correspondent Saray Chen reports.
A mother of two from the Salt Lake Valley suspects she got COVID-19 after attending an event with about 50 people in early March.
That was on March 11th. A couple of days later, on the 15th of March, I wasn't feeling well.
Abby started having unusual symptoms.
I was experiencing loss of smell, night sweats, chills, weakness, tremors, shortness of breath, sinus and teeth pain.
At the time, in March 22nd and March 15th, these were dates where you would have been considered asymptomatic because it wasn't public yet about this loss of smell.
Correct.
At the time, the medical community wasn't clear on these symptoms either.
What did you think you had?
The physician that saw me at the COVID-19 tent made the assumption I had a sinus infection. He gave me antibiotics.
She didn't qualify to be tested in the beginning, so she went back to work.
There was a struggle to get tested to begin with.
Yes, an extreme struggle.
But finally, more than 2 weeks later, on March 31st, she got tested, only after the event coordinators notified her the people she was sitting next to tested positive for COVID-19. Several weeks later, the Utah Health Department released her and deemed her recovered.
And that's the frustrating part. Months later, I'm still struggling with weakness, shortness of breath. I occasionally experience chest pain.
Abby fears she has long-term organ damage. She's reached out to specialists and a cardiologist, but answers have been hard to come by.
This is a fascinating thing that we're finding now where individuals who end up having COVID-19 could indeed have and trigger autoimmune reactions and symptoms that can basically happen for life.
Dr. Joshua Redd of Red River Health and Wellness in Utah recently conducted an antibody test that included hand-picked people who had COVID-19 and found Abby wasn't the only one suffering from these post-virus symptoms.
It's also attacking brain, mitochondria, thyroid, and the intestinal tract.
Dr. Redd has spent the last 10 years devoted to autoimmune diseases and embarked on a study to find out more about COVID-19 antibodies.
In Utah, there wasn't any antibody tests that were available. Nobody was really doing antibody testing and research, and that's something that I know if we could have access to correct antibody information, it could shape how we move forward in the things that we do.
Including specific treatments for her autoimmune responses post-COVID-19.
It's really important to me that somebody is listening because had I not seen Dr. Redd, I would have continued to experience the pain, the aches, the shortness of breath.
You see she has a low thyroid, she has positive TPO antibodies, and potentially antibodies attacking the cerebellum and neurological tissue.
Dr. Redd has helped customize some of the treatment for Abby according to her post-COVID-19 symptoms that have lingered and persisted even months after the state health department deemed her recovered.
I'm already seeing an improvement of my symptoms. You could end up potentially with some long-term problems. So, use a mask, practice social distancing.
What is your hope in all of this?
That I can provide some path to recovery for future COVID-19 patients.
Abby recently returned to work. She says she didn't infect anyone in her office. Abby's COVID-19 symptoms were considered mild to moderate. She says she hopes by sharing her story that she can help others either prevent getting the virus and help get others through those post-virus symptoms. Saray Chen, ABC4 News.